like you do this.
Okay. Good afternoon. My name is Gina Rogers. I'm a student at Western Governors University, and I'm here today to talk to you about the benefits to women of taking folic acid supplements during early pregnancy. The main benefit to women of taking a folic acid supplement during early pregnancy is to prevent neural tube defects. And this is especially important in women who've had a previous pregnancy with a neural tube defect. Every year, over 3,000 children in the U.S. are born with neural tube defects. Various studies in many different countries have concluded that there is a definite relationship between a folic acid deficiency and neural tube defects. A neural tube defect results from failure of the neural tube to close properly, and this is a result of impaired cell formation or abnormalities in the cells. So it's important that we teach women the importance of taking folic acid supplements before and during pregnancy. This is important for women of all childbearing age. Neural tube comprises the brain, the spinal cord, and the spinal column, and this forms during the first 4 weeks of life. The two most common types of neural tube defects are anencephaly and spina bifida. This information was taken from the March of Dimes and the Spina Bifida Association. The first one, anencephaly, occurs in 1 out of 10,000 births each year. It's a neural tube defect that occurs around the 23rd week of pregnancy and results in an absence of a large portion of the brain. Infants who are born with this condition are usually stillborn or die within a matter of a few hours. The second most common is spina bifida. It occurs in 7 out of 10,000 births each year, and it also occurs around the 23rd week of pregnancy. And it results in a gap of the vertebrae that form the spinal cord, allowing the spinal cord to prolapse. And the severity of this depends upon the damage to the nerves of the spinal cord. So it can occur in varying degrees of severity. New cell formation is definitely dependent upon sufficient levels of folic acid in the body. So a folic acid deficiency has definitely been proven to cause neural tube defects. Various studies have shown that just supplementing with 0.4 milligrams of folic acid before and during early pregnancy can reduce the number of neural tube defects by up to 70%. Women who have had a previous pregnancy may be recommended, a previous pregnancy with neural tube defects may be recommended to take a folic acid supplement of up to 5 milligrams a day. In 1998, the United States made it mandatory for folic acid fortification of cereal and grain products in an effort to help reduce the number of neural tube defects. So some of the things that we can do to prevent neural tube defects is to eat a folate-rich diet, which would include cereal and grain products, and other foods such as broccoli, asparagus, collard, and mustard greens. Just to name a few, these are all high in folic acid. One study by the Gallup organization between 2003 and 2007 of a group of women between the age of 18 to 45 concluded that women between the ages of 18 and 24 had the least knowledge of the importance of taking a folic acid supplement. And these women account for about 1/3 of the births in the United States each year. So it's very important that we get better educational methods. So in conclusion, we know that folic acid plays a vital role in preventing neural tube defects, and it's imperative in new cell formation. Following a diet high in folate-rich foods and taking the recommended daily supplement of 0.4 milligrams has been shown to reduce the number of children born with neural tube defects by up to 70%. Which would greatly improve the current statistics on the number of children born with neural tube defects. Studies also support the need for more aggressive education of women and the importance of taking folic acid supplements. And this is especially true for women between the ages of 18 to 24. Do you have any questions?
Yes, I do. I have a question. If you have a child born with a neural tube defect, what are the chances of having a second child born with this kind of defect?
Studies indicate that there's a recurrence rate of around 2 to 5%.
Okay, and I have one other question here. Do most vitamins contain folic acid?
Yes, most multivitamins and all prenatal vitamins contain folic acid.
Okay, thank you.
Well, that concludes my presentation today. Thank you.
Very good.